You're watching this video because your doctor has recommended Burr hole drainage of an abnormality in the brain. This is surgery to remove as much of the abnormality as possible through a small keyhole in the skull. You'll typically have general anesthesia, also known as being put to sleep. You'll then be positioned on your back, side or front, depending on the location of the abnormality within the head. A metal head clamp may be used to hold your head safely. Some of your hair will need to be cut or shaved to prevent infection getting into the wound. Where this will be and how much hair is removed will, again, vary depending on the personal requirements of your operation. 3D computer technology, like satellite navigation for the brain, is usually used to help guide the surgeon. To begin, your surgeon will make a cut in the skin of the scalp. A special drill is used to make a hole in the skull. It's designed to stop if it reaches anything soft. The incision and bone window may vary in size, shape, and position, depending on your personal requirements. The tough lining around the brain, known as the dura, is then opened to reveal the brain. The surgeon will then attach a special clamp to guide the biopsy needle. There are many different techniques and types of navigation equipment that can be used to achieve this. They all share the same basic principles as the technique shown here and allow the surgeon to carefully navigate to the area of abnormality. The path to the abnormality will be chosen by the surgeon to cause the least damage to important structures within the brain. The surgeon will then carefully remove as much of the abnormality as possible through the tip of the needle. Then the needle and clamp are removed. To finish, the surgeon may leave or replace some of the removed bone. They may partially or completely cover the defect with a metal plate. The healing process will fill some of the gaps left behind, but there may be a permanent small bump that you can feel. This is usually, but not always, covered up by the scalp and hair. The surgeon will then close the scalp with sutures or staples. You will have a wound dressing and may have a head bandage applied as well. It is likely that some of the removed tissue will be sent to the laboratory for detailed analysis. The healthcare team will contact you to discuss the results when available. Please ask your surgical team for your personal postoperative plan after the procedure has finished, so they can give advice based on your needs. When considering whether to have a procedure or treatment, you should consider the potential benefits, the potential risks, and whether there are any alternatives available, such as medication, radiotherapy, less invasive procedures, or even not doing anything at all. You should take time to ensure you've considered all of this carefully. Between 1 and 5 in every 100 patients suffer from minor or treatable complications from this surgery, such as infection, which is when bugs get into the wound. You may need antibiotics to treat it. Bleeding or bruising. You may get a black eye if the bruising travels downwards. This usually resolves on its own over a few weeks. Seizures or fits, which are a sudden uncontrolled electrical disturbance in the brain. It can happen because of irritation to the brain during or after an operation. It's treated with medication that reduces seizure activity. Headaches. Some patients suffer from these after surgery. This is often temporary, but it may, unfortunately, be permanent. CSF or cerebrospinal fluid leak, which requires you to stay in the hospital slightly longer to ensure it heals up before you can go home. If it doesn't stop on its own, you may need a drain or another operation to fix it. Hydrocephalus, which is a buildup of fluid within the brain. This may require a drain to be inserted during the operation or at a later date. Pressure on skin, nerves, or eyes. Problems with positioning during the operation, which might include pressure problems, skin and nerve injuries, and eye complications, including, very rarely, blindness. Special gel mattresses and operating tables are used to minimize this. More serious and sometimes untreatable risks include stroke, which is a type of brain damage. Brain operations can cause strokes in up to 5 out of 100 cases, but can be higher, depending on the area of the brain being operated and the abnormality. A stroke can lead to weakness, paralysis, problems with sensation, speech, memory, vision, concentration, or personality changes. If it's a large stroke, you may not wake up properly. The changes you experience will depend on the area of the brain affected. Different parts of the brain have varying functions and importance to your ability to live your life normally. There's no medical treatment that reverses a stroke. However, in some cases, the brain forms alternative pathways to help overcome the problem caused by it. If you suffer a stroke, you may require a prolonged period of rehabilitation at a rehab center or even at home. It may significantly affect your ability to work and live your life fully. Medical or anesthetic complications, such as blood clots in your legs or lungs, which may affect your breathing, heart attack, and other medical or anesthetic problems can occur. Death. Rarely, death as a result of damage to major blood vessels or vital brain structures. If one of these uncommon risks turns into a complication, extra procedures may be required, such as blood transfusion or further surgery. Thankfully, for most patients, there'll be no complications. You'll be encouraged to mobilize as soon after the procedure as you can. Most patients go home within a few days. The surgical team will be in contact about next steps and if any further treatment is required once they get results from the laboratory. The contents of this video are a general depiction of this procedure and the risks involved. It's not necessarily accurate for your personal situation. Information specific to your individual circumstances is listed in the written consent information sent to you by your healthcare team.